The state health department in Hawaii says snorkeling deaths have nearly doubled in the past 4 years. They were 16 in 2014 compared to 31 last year. And now investigators are trying to figure out what's behind the spike. Some businesses believe full-face snorkel masks are to blame. A lead investigator for the state study says they're looking into the full face mask idea, but adds that there are more than 100 different snorkeling devices and that a snorkeler's experience is also a factor.
We have a lot of hypotheses and theories, none of which can be certain. Certainly there are certainly more people in the water snorkeling. Certainly have more tourists snorkeling. We have more devices of various kinds.
Many companies in Hawaii aren't taking any chances, though, and are already banning the use of full-face snorkeling masks. Have you ever woken up in the morning with your jaw aching or an awful headache? Well, you could be taking your stress out on your teeth. Juliana Falk has more on the signs to look out for.
At Green Bay Family Dental, Dr. Eric Olvey sees a lot of patients.
Just keep doing what you're doing. It's working for you.
Thank you.
Any questions for me?
With a similar issue.
We do a fair amount. There's a number of possible causes.
That issue?
Teeth grinding and teeth clenching and the effects of it are something we deal with almost every day.
Taylor Castor works at Dr. Olvey's office and is also one of the many patients who struggles with this.
I was starting to have jaw pain. I would wake up in the morning, I have headaches.
Many times it's stress.
You don't even really realize it, and especially when you're trying to fall asleep and you're thinking about what's going on the next day.
Dr. Olvey says stress is one of the common causes for grinding and clenching.
I think young people, whether they're college students or getting out into the working world, might be showing signs of their stress through their teeth.
And doing that, he says, can cause a lot more issues than just pain.
There's every bit of a risk for teeth damage, teeth wear, damaged dental restorations, and then in the severe cases you can actually crack teeth so severely that they're non-restorable.
So how can you try to prevent this from happening?
We have, the use of mouth guards in addition to maybe some behavioral modifications, getting enough sleep, making sure they're healthy, watching their sugar and their caffeine intake.
Mouth guards keep the teeth from touching. Dr. Olvey says teeth are only supposed to touch for about 20 minutes a day for things like chewing and talking.
And the rest of the day, the teeth are supposed to be separated from each other. And so the concept behind the use of a mouth guard is that they keep the teeth apart and keep the teeth subsequently protected.
And as people like Castor say, that could be enough.
I'll put my mouth guard in even before I fall asleep, and I can tell a difference even just from that. Sometimes I wish I could wear it during the day.
Well, people don't just grind or clench their teeth at night. It can also happen during the day. Dr. Olvey says stress is just one of the reasons for tooth wear. It can also be from a sleeping disorder like sleep apnea.